Are you currently breastfeeding or about to be breastfeeding and you're wondering about, will breastfeeding prevent me from getting pregnant? Because this is what I've been told. I'm going to be breaking down what is Lactation Amenorrhea Method for birth control and how can we utilize it during the postpartum to prevent ovulation, to prevent pregnancy. Welcome to the MamasteFit YouTube channel. I'm Roxanne. I'm a labor and delivery nurse and student midwife, and I'm going to be breaking down what is Lactation Amenorrhea Method, or LAM, that some people will refer to, and how is this going to prevent pregnancy. So lactation amenorrhea is literally what it sounds like. Lactation, so breastfeeding, producing breast milk. Amenorrhea means no period, so no menstrual cycle, and then method just kind of means the method that we're using for birth control or preventing pregnancy. So lactation amenorrhea bleeding is 98% effective when used appropriately. But there are three main things that we're going to think about with lactation amenorrhea bleeding. This is where we're going to prevent ovulation because when we are breastfeeding, we're producing two main hormones, oxytocin and prolactin. Oxytocin is going to help with our milk letdown reflex to help with the milk coming out, but prolactin is really important for our milk supply in creating that milk. But prolactin also suppresses ovulation. So this is a common test that we'll even use when someone has amenorrhea, so no menstrual cycle outside of pregnancy, to see if maybe their prolactin level is really elevated and that's why they're not having a period. So prolactin, really great hormone for breast milk supply, but also could be preventing periods because it's preventing that ovulation. The three main things in order for lactation amenorrhea method to work are you have to be less than 6 months postpartum. You have to be exclusively nursing your baby. And a lot of people will say pumping could qualify, but some people will say only latching baby is how that prolactin is at that certain level. So depending on who you ask, will say one or the other. From what I've researched though, latching baby exclusively, so no formula, no bottles, just exclusive latching your baby is what is effective for the lactation amenorrhea method. So less than 6 months, exclusively latching baby, and no more than 4 hours in between each feed as well. That is key for the lactation amenorrhea, but the timing of how often baby is feeding. Some will say if baby goes 6 hours at nighttime, that is okay and qualifies for this to be effective. But a lot of people will say that 4 hours in between feeds is like the max length. And then the last one is no menstrual cycle. You can't be having a period for this lactation amenorrhea method to work. So just to review, less than 6 months, exclusively nursing your baby, going no more than 4 hours between feeds, as well as no menstrual cycle. If you have all of those three things, lactation amenorrhea method is 98% effective. They have started doing some more studies, though, for past that 6 months. And so between 6 and 12 months, if baby is still exclusively nursing, adding some food in, because at 6 months is when we start introducing solids to babies, but still between that 6 to 12 months, if baby's still exclusively nursing, maybe eating a little bit of food, it can be up to 92% effective still for that 6 to 12 months. So still pretty effective, especially if you have yet to get your period back. But it's not 100% effective. So out of 100 people, for the first 6 months, 2 people out of 100 using the lactation amenorrhea method will still get pregnant. And between 6 and 12 months, like 8 people out of 100 will still get pregnant, even if they have all of those three criterias. But because it's not 100% effective, some people would still like to add on an additional birth control, whether that is just using condoms or some sort of barrier method like a diaphragm, or even adding in hormonal contraception such as birth control pills or an IUD. So these are all conversations that you can have with your provider on birth control methods, especially once you hit that 6-month mark. Depending on what your plans for your next pregnancy, or if you're not wanting another pregnancy, this is the time to definitely start having that conversation with your provider on how you're going to prevent future pregnancies, whether using hormonal methods, barrier methods, or using the natural family planning method where we're measuring and monitoring our fertility signs. With lactation amenorrhea method, there are benefits and downsides for it. Obviously, the downsides would be it's not 100%, so there are still a chance you can get pregnant during that period. But the same with other birth controls. There is a limited time. So for that 98% effective, it has to be within that first 6 months. And it does require you to exclusively breastfeed your baby, which can be time consuming as well as not an option for everybody. Not every baby is going to be able to latch to the breast. So those are two pretty big downsides to it, as well as it doesn't prevent sexually transmitted infections. So if you're at an increased risk of contracting a sexually transmitted infection, lactation amenorrhea method might prevent pregnancy, but it does not protect against that. But the benefits of lactation amenorrhea bleed, because there's always benefits, is one, it's pretty inexpensive. Like, it's just your body. So if feeding yourself is the expense, but your time is also important. So like, there is the time factor of this method. There are no hormonal methods that you're introducing to your body other than the oxytocin and the prolactin that's creating and producing and getting the milk out of your body. You're not adding any extra hormones to your body with hormonal contraception. So that's a huge benefit that a lot of people like. It's also giving you protection immediately after birth, that you are not going to be ovulating. So you don't have to worry about that window of like there being a period that you still potentially could get pregnant with the lactation amenorrhea bleed, because it literally starts the moment that baby comes out. So that is the lactation amenorrhea method. So just to recap, lactation amenorrhea method is when you're preventing ovulation by breastfeeding, and it is 98% effective when you are less than 6 months postpartum, you are exclusively nursing your baby with no greater than 4 hours between each feed of you latching your baby directly to the breast, and you have no menstrual cycle. So you are not having a period actively. Those are 3 signs that you are not ovulating. Your body is preventing ovulations by lactating, and this is going to decrease your risk of getting pregnant. There are many benefits and downsides of lactation amenorrhea bleeding. The benefits are that it's free. It does not cost anything other than feeding yourself and your time. It is a really nice way to bond with baby. It's also no hormonal, like you're not adding hormones to your body, and it starts immediately after birth. There's not a window that you have to wait for the medication to start working. But some downsides is not everybody's able to breastfeed their baby. It is limited in time, that it only works for the first 6 months, like super effectively. After that 6 months, it does decrease to 92% effective, and it does not protect against sexually transmitted infections if you are at risk of contracting something like that. But it can be a really nice method to prevent future pregnancies. But if you're wanting to have close interval pregnancies, the lactation amenorrhea method actually could decrease the likelihood of being able to conceive because of the suppression of ovulation. So this would be a really great conversation to have with your providers on planning your next pregnancy, on whether the lactation amenorrhea method works for you, or adding more hormonal birth control works better for you, or there's another method that you can discuss with your provider to kind of create a plan for your family planning. If you enjoyed this video, please like and subscribe to our channel so you can be notified whenever we release new educational videos. And if you're pregnant or postpartum looking for more education, we have a childbirth education and we have prenatal postpartum fitness that you can check out on our website at MamasteFit.com. And as a thank you for listening to this entire video, you can use code YouTube10 to get 10% off any of our offerings on our website.